Hello and welcome to Cambridge Clinical. This video will be discussing how appropriate questions. In these questions, you'll be given a scenario and then a list of responses to that scenario. Your job is to determine how appropriate those responses are. In these questions, you will always have the same four answer options. The responses can either be very appropriate, appropriate but not ideal, inappropriate but not awful, and very inappropriate. In this video, we're going to go through examples of how you can differentiate between these four options. There are a few questions you can ask yourself to help with this process. The easiest one is, will this action have a net positive effect or a net negative effect? If it's net positive, the answer will likely be appropriate to some degree. Similarly, if a response has a net negative effect in your view, we can say it's inappropriate to some degree. Now let's say, for example, we've had an action that has a net positive effect. How can we then establish whether it is very appropriate or just appropriate but not ideal? In these scenarios, I always ask myself, is this action the optimal way to achieve the effect? If it is, it's probably very appropriate. Also ask yourself if there are any downsides to acting in this way. If there are no downsides, except perhaps those that are totally unavoidable, then we can say again that it's very appropriate. However, if you think there are better ways to achieve the same effect, or ways with fewer downsides, we can probably say that the option is appropriate but not ideal. Now let's imagine that you've been given a response that you deem will have a net negative effect. At this point, ask yourself if anything positive is going to come from your action at all, because sometimes very inappropriate actions can still generate some upsides. If this is the case, it's probably inappropriate but not awful, depending on the extent of the harm being done and the extent of the upsides. Also, ask yourself, is this answer inappropriate because it's directly harmful, or because it's just useless? If it's just useless, then it's likely inappropriate but not awful. However, if it's directly causing harm, it's almost always going to be very inappropriate. Now let's try and apply these rules to a real example. So the passage reads, Loki, a medical student, is on placement in a hospital. He is shadowing a doctor, Dr. Nicholas, who is reporting test results back to a patient, Rhea, who has been suffering with chronic stomach pains. Dr. Nicholas informs Rhea that all of her tests came back normal and that the chronic stomach pains may just be a result of irritable bowel syndrome. Dr. Nicholas then promptly leaves to attend to an emergency. Rhea tells Loki that she's upset that she still does not have a diagnosis. How appropriate are each of the following responses by Loki in this situation? So there are four total responses. We'll deal with them in two pairs. So first of all, we've got, I understand that it is frustrating that you do not have a diagnosis yet, and come back if you're having any problems in the future. So why not pause the video now and try and ask yourself some of those questions we went through to determine how appropriate these are. Thinking of option 1 then, let's ask ourselves the first and the easiest question. Is this response going to have a net positive or a net negative effect? Now we're told that Rhea is upset, she's probably frustrated, and so the effect we want to have is one of reassurance. And I would argue that option 1 definitely has that effect. So given that it's positive, is it the optimal way of providing reassurance, and are there any downsides associated with it? I would argue this is pretty optimal. You have to remember Loki's role is that of a medical student, not a qualified doctor, so he shouldn't be doing things like providing new diagnoses. His job is just to comfort and reassure, and I would argue that he's definitely done that. I also don't think there are any downsides to this approach. So we can argue that this is a very appropriate response. Looking at answer number 2 then, come back if you're having any problems in the future. Why not pause the video again and ask yourself, is this net positive or net negative? Overall, this probably is more positive than negative, because they're letting Rhea know that they'll be there for her in the future, and that they're not dismissing the fact that she might have issues again in the future. However, ask yourself, is this the optimal way to react, and are there any downsides? So clearly, if you compare this response to the first response, this is much less empathetic and understanding, so it's clearly not the most optimal way to provide reassurance. I wouldn't say there are any severe downsides, however the lack of empathy might make the patient feel alone and indeed more upset. So we can say overall, because it's net positive, it's appropriate, but because it's not optimal and there are some potential downsides, it's not ideal. Here are the other two responses now. Number 1, I will ask Dr. Nicholas if he can do any other tests, and number 2, you should be happy that it's just IBS. Now again, pause the video if you want and ask yourselves the key questions to figure out how appropriate these responses are. Focusing in on answer option 1, I will ask Dr. Nicholas if he can do any other tests. Is that net positive or net negative? I would argue that this is a net negative answer, purely because it gives a sense of false hope. Dr. Nicholas has been quite clear in the passage that there's likely nothing that can be done, and so when Loki says something like this about offering more tests, it conflicts with the advice that's just been given from the doctor. At this point though, ask, is anything positive coming from this at all, and is it actively harmful or is it just useless? So even though it is a negative thing to say overall, I do think it would be nice for Rhea to feel like she's being listened to and that her concerns are being taken seriously. It's certainly better to give the impression that you're trying everything to help than merely dismissing a problem. Now, we could definitely debate whether in this case giving a false sense of hope is harmful or just useless. However, I would argue, again, in this specific case, given it's only a medical student saying this, which Rhea knows, and also given Dr. Nicholas has been fairly clear already, the hope given is probably not going to be excessive. It's probably more just a useless thing to say rather than causing major damage. Therefore, we would say that this answer option is inappropriate but not awful. Next, considering option 2, you should be happy that it's just IBS. It's quite clear that this is a totally negative thing to say. It's not going to give the impression that they're taking the problem seriously at all, and it's probably going to just make her upset and her frustration all the worse. Furthermore, I don't think anything positive at all comes from this response, and because it increases upset and frustration, it is actually harmful and not just useless. So we can say that this is a very inappropriate thing to say. So that concludes this video. Just remember always to ask yourself those questions we went through, and you should be fine.